Earlier this week, an Ivy League-educated man in his mid-20s became the prime suspect in the murder of a healthcare executive last week. In the aftermath of the killing, there's been an outpouring of much anger that's been targeted at the healthcare industry and at corporate America, making many wonder if this incident could change the way the healthcare insurance industry operates. Joining us right now with his expert insights is Mark Bertolini. He's the CEO of Oscar Health. He's also the former chairman and CEO of Aetna, among a lot of other different positions that he's held in the healthcare industry. And Mark, I want to thank you very much for being here.
It's great to be here. Thank you, Becky.
You are somebody who has so many insights into how the healthcare industry works. And I know you've got some big thoughts about what should change. You've been thinking about this for a long time.
Yep.
We've talked to you for many years about these things. But obviously, there's a huge amount of attention that's being put on this in the public and in Washington. And there might be a real opportunity for change. Just wonder, first of all, what you think about what you've been hearing back from the public and the anger over denials and where we stand at this point. I mean, it's kind of crazy that we've gotten to this point.
Well, I think the anger is justified. You can't talk to anyone in this city and not get a story about a claim denial or a prior authorization. I was just talking with some of the people outside, getting the right drugs, whatever. And I think what's happened is the provision of health care, the actual investment in people's health, has changed dramatically, while the insurance industry hasn't, and the way we buy health care hasn't. 80 years ago, we created this employer-sponsored system because we were trying to offset inflation, so no wage increases, but we could offer benefits. At the same time, there was this expected population explosion. And then we had the Hill-Burton Act in the 50s that built hospitals everywhere. And so we created both demand and supply increases that have not slowed since. The population boom happened and all of this costs. I mean, if you look at the percentage of GDP going to healthcare, it's now just under 20%. And in 1984, it was 9%. So as you look at these changes over time, we've just outrun our ability to afford the way we do it.
There are questions about whether we get appropriate outcomes for the amount that we are spending on it. I would argue that since 1984, healthcare has gotten better for the vast majority of Americans, but it still falls short and falls short of expectations when you're talking about spending 20% of GDP.
And life expectancy's gone down.
Yeah.
Is it lifestyle, or is it? I mean, the healthcare is better, and we have the best. We have the best technology in healthcare in the world. But if we're gonna, if 50% of the population is going to be obese, you're running into a buzzsaw. You can't. There's no healthcare that is going to be great enough to handle the lifestyle problem.
Your zip code matters more than your genetic code in your health. So how you live and where you live actually matters. And so we have huge issues in rural communities around the country. But probably the most important thing is that healthcare has now become very individualistic. I want it to be fit for me. And when my employer buys my healthcare coverage, they buy for the average.
Right. So what would you do? I mean, look, Elon Musk was out there just earlier this week. We were talking about it yesterday, suggesting that the answer is if we could get a huge percentage of Americans on GLP-1s, we could bring the cost down of healthcare in a remarkable way, especially if you could get the price of GLP-1s to come down in a remarkable way. What would you do?
What I would do is I would eliminate employer-sponsored insurance.
You say that, and it stops my heart a little bit, because those of us who have employer health care think, oh, my gosh, getting thrown in so everybody's dealing with Medicare Advantage. That seems like a pretty terrible thing. And I would argue that my health care insurance, while I'm not always thrilled with it, at least I have an employer who can go and argue for the mass of us. There's a lot of us, and that at least has some bulk. If I'm out there on my own, it feels like there wouldn't be any protection that comes with it.
The ability of your employer to negotiate against a large insurance company that has much a larger relationship with the provider community is very stinted now. You can't get stunted. You can't do it now.
You're saying the companies have no leverage?
The companies have no leverage now.
Interesting.
And you look at the basic foundation of our economy, which is small business and middle market, they have none. And they're seeing double-digit rate increases when just over at in the individual market, our trend's been 3.5% each year. Why?
Do the claims get turned down more readily in the individual market than they do? So it's the same.
Our denial rate's less than it's 12%. is our denial rate.
UnitedHealthcare, I'd seen 23 to 33%.
Yep, and the only one that's lower than we are is Kaiser, because they don't do it. And Kaiser doesn't do it because the physicians are taught to practice in a certain way with one another.
Right.
So they know how to refer within the system and to the right people.
But here's what we hear. We hear things like AI systems being put in place at UnitedHealthcare that are turning down claims and overruling doctors that are requesting it. I've heard Aetna, where you used to be the CEO, that there were health claims officials who testified that, oh yeah, we denied people's requests without even seeing their medical records at times. I mean, it's that much of a system where doctors will complain that they have to hire multiple people just to sit online to get through to insurance companies to then be turned in.
What we've known for more than 20 years in the insurance industry is that the large majority of prior authorizations that we do always get done anyway. But yet we make everybody go through the hoops. And the reason is again, employers buy for the average of their employee population. They buy large networks because their employees use a lot of providers. And as a result, the ability to negotiate a better rate with that provider group is a lot less because you got everybody in. But when you get narrow networks, which is what's happening in the middle in the individual market, and you have everybody in, an individual can find their network. They don't have to rely on their employer to build the network.
Does it mean that as an individual, if I'm really healthy and young, I can get a much better premium, but if I'm somebody who has a family and is using the healthcare system, I'm going to be paying a lot more?
So here's how you have to think about it. You have to think about the employer giving to employees what they've traditionally given them for benefits. It's defined contribution instead of defined benefit. You allow that employee, with some assistance, to understand what's going on in their use of health care to get them into the right plan.